visions. All right? You got ideas about this now. The parasympathetics will do these things over here. The sympathetics will do these things over here. Just think about it. It'll make sense to you. If you're there relaxing, what would you expect your heart to do? What would you expect your brain to do? What would you expect your muscles to do? And that kind of stuff. This one I took from another school, the other school, and he gave me permission to use it from his book that he made. And this is actually pretty good too, about, here's the organs over here, the sympathetics, here's what goes on, and the parasympathetic, what goes on. So I would try and put these in memory because you're going to use these for the rest of your life. The next 4 slides are a little bit more detail about each one. You could choose to do that too, whatever's going to help you. But try to deduce why the divisions cause these particular actions. If a bear is chasing you, if you're taking one of my exams, what would you expect each to do, each organ to do? I mean, what's the point of making your heart race during those times? Because you want the glucose to go up into your brain so you can think better on my exams. So you would expect that there's going to be a breakdown of glycogen to put more glucose into your bloodstream to get to your brain. So you're going to have breakdown in glycogen occurring in sympathetics, but you're going to be building up a glycogen when you deal with parasympathetics. It makes sense when you really think about it. So these slides over here, it's a little bit more detail, but it helps you if those are too vague for you, and you can go do those on your own. Okay? Now, also to help you, this is something I used in college, and I thought this was helpful. I'm going to read this to you, but as I'm reading it to you, just look at the picture as I'm reading it to you, and you'll see this is helping you for the sympathetics. The fight or flight response demonstrates the ability of the sympathetic nervous system to provide energy for vital functions. Decreased pulmonary secretions and bronchodilation increase blood oxygenation. That makes sense. Increased heart rate and contractility increase or improve cardiac output. The amount of blood exiting the heart, cardiac output. That makes sense. Arterial constriction shunts blood from the skin and digestive system, whereas arterioles in the heart and skeletal muscle dilate to supply more blood to the latter organs. Bears chasing. Glycogen and lipid breakdown and glucose is synthesized for energy. The GI or gastrointestinal motility and secretions decrease and urine is retained because you can't fight a bear when you're urinating, right? It just makes sense, okay? Now, with that said, let's show you what I call the parasympathetic pig, okay? Now, parasympathetics, it's mostly opposite. The parasympathetic pig's heart beats sluggishly while his digestive tract hogs the energy, okay? He's drooling because of his increased secretions. He needs to breathe oxygen because his bronchioles are constricted. He's defecating and urinating, and he has an erection, but you'll have to picture this as none of these are drawn for modesty. Okay? The sympathetic system, by the way, controls ejaculation. Notice how tiny his pupils are compared to the scared boy in the other figure, right? See how small they are? And here, dilated, right? That's why whenever you hear that, song Poker Face by Lady Gaga, Poker Face. They see if you're excited. That's why if you want to look at, a lot of people, when they're playing poker, don't wear sunglasses. They don't allow it. But you could look at people's eyes, and if you see them dilated, the pupils, they're excited. There's something in his hand that's exciting him. Right? It's easier to see if you have light irises, like if you have blue or green eyes. Brown eyes difficult to see, but when they're dilated, yeah, there's something exciting that person. So you can pay attention to their eyes. Okay? So now you understand why you get that funny feeling in your stomach. See? Good stuff. All right, now, control of the autonomic nervous system, several control mechanisms. Like I said, the hypothalamus are going to be our main control, really the supervisor of the whole thing, okay? You also have the brainstem, and you have certain cardiac nuclei there, especially in the the medulla oblongata. All right, it's going to have those areas there where it's going to deal with blood pressure, cardiac areas. You also have spinal cord reflexes for defecation and urination. And we have the cerebral cortex that could bypass some of those reflexes. Hey, you have the urge to go to the bathroom, but your brain says, I'm not in an opportune moment to go to the bathroom. So you could bypass those. Does that make sense? Or you could block that feeling. And sometimes it'll make it go, like after you eat breakfast, you might have to go, or you will have to move your bowels. You have that urge to go to move your bowels about 20 minutes later. But you're driving to school. So, that feeling usually lasts about 10 or 15 minutes and then goes away for about 10 hours because you could bypass that, okay? Which helps you a little bit when you need to, it's called the gastrocolic reflex. Don't eat a big meal before you have an interview because you'll have that urge to want to poop, okay? Also, if you have a big date, don't eat a big meal before, all right? You might have these little bursts of flatulations coming out, okay? So it's that kind of thing. I use the anatomy and physiology as a manual about yourself, so it'll help you along with how to control certain things. Okay, so the last thing I want to do is this pharmacology. It's not bad. It's just basically 4 or 5 slides, and how to put the stuff together, at least an intro to pharmacology. So what we have is many drugs act on the autonomic nervous system. As you can see, we can either make acetylcholine come out faster, slower. You could block receptors. You can stimulate them. You can do a lot of different things. You can block receptors. A lot of different things going on here. Okay. It gives beneficial results for certain diseases. And like I said, about 60% of your medications deal with the autonomic nervous system. You have 2 basic effects that occur. Either could be an agonist, something that's going to stimulate that receptor to turn on. So we could have these agents that can mimic the sympathetic or mimic the parasympathetic. Okay? Or the other effect is an antagonistic. They're blockers. We're going to block the receptors. We're going to decrease the amount of norepinephrine from getting released from the presynaptic membrane. So you're either going to have basically an agonist, something that's going to turn it on, a stimulant, or something that's going to be an antagonist, something that's going to block it or inhibit it. Okay? So if you understand the autonomic nervous system, then this should be a piece of cake for you. Does that make sense? Okay? So it'll make sense to you. So these are adrenergic receptor agonists. Now I'm not going to ask you the names of these and what they do. I'm just giving you examples of different adrenergic agonists, which I guess many of you have either seen before or are going to see before. Okay? Ephedrine, amphetamine, albuterol, terbutaline. Cocaine is also a way of, it's going to keep the neuroepinephrine in the synaptic cleft for a longer amount of time. So you're going to turn on these things, and that's going to make your heart go really fast, and you'll have a heart attack or something like that. All right? It'll also vasoconstrict things, the blood vessels. Epinephrine is going to give a shot of epinephrine. So it's not here to, I might give you an idea. I might say albuterol is an adrenergic agonist, which means what? So I'm not going to expect you to know the medications. I expect you to know what an adrenergic agonist is and the effects that it would do. Does that make sense? Okay? And these are some indications: cardiac arrest, anaphylactic shock. You give the epinephrine pen or the EpiPen kind of thing. All right? These will dilate the pupils, right? If they're going to stimulate the eye, and these are sympathetics, it's going to dilate the pupil. Okay? So these are adrenergic agonists. We could have adrenergic antagonists, and here's some examples of them. Alpha blockers. All right? And we also have beta blockers, propranolol stuff. You've heard of these. I'm sure you have. If not, you will. Okay? So the indications here is that it's going to do these things on here, like HCN is hypertension. So this drug is going to, if it's going to decrease the amount of sympathetics going to your smooth muscles of your blood vessels, so they're going to dilate them, and that's going to decrease your blood pressure. Okay? So it does these things on here. Again, I'm not going to ask you about the names of the medications, but you should have an idea by knowing what sympathetics and parasympathetics normally do, then it's going to increase this or decrease it. Then we have cholinergic agonists. And we can give acetylcholine. You could have the stigmine and a few other ones on here. Okay? Now in essence, if you just think about it, adrenergic antagonists can give similar effects as cholinergic agonists. Just think about that. Adrenergic antagonists are going to turn down the sympathetics, kind of making the parasympathetics be a little bit higher. A cholinergic agonist is going to make the parasympathetics go up higher, which means that the sympathetics will be low. So they're going to give similar effects. Does that make sense? Okay? So that's why you're going to see things in here. Like we could use these medications to also control hypertension, because turning these on will vasodilate the blood vessels. So why is this important? Why should we have two different medications doing this? Because it's side effects. Maybe in the adrenergic antagonist, maybe there's side effects where the patient just doesn't like. So then the doctor or nurse practitioner will say, well then let's try a different family of drugs. It's still going to decrease your blood pressure, but it has different kind of side effects and it might not be so severe for you. So it's nice to have other medications and understand what these are actually doing. Okay? We've also mentioned myasthenia gravis. It's going to increase acetylcholine in the synaptic cleft. Myasthenia gravis is a good example of when you would use something like this. Okay? Then we have cholinergic antagonists, which are similar to adrenergic agonists. Think about that. Okay? These are some examples, and you've heard of those: scopolamine, atropine, right? Who here wears glasses, right? Atropine droplets in your eyes. What is it going to do? Dilate your eyes. Okay? So it's going to dilate pupils. But we don't want atropine, we don't want to give you a shot of atropine that's going to dilate your eyes, because that's going to be systemic. That atropine is going to go throughout your whole body. And you're going to start having shakes, you're going to have a lot of other things going on. Your heart is going to race. So they like to give you a few drops, localized area of atropine. A few eye drops in there, so it just hits a localized area and it won't last more than a few hours. If we give it in the bloodstream, it's going to go to all the receptors throughout your whole body. Not a good thing. All right, person probably won't go to that doctor anymore. The way it's going to make them feel. Okay. So, and we could also use it for diarrhea, right? An antagonist, a cholinergic antagonist, parasympathetic antagonist. Then we're going to use some kind of medication to slow down the GI system, so you won't have diarrhea. It gives it some time for water to get absorbed into your bloodstream, not to stay in your stool and then you go out. So these are just some examples. Okay? And that's it. That is the entire autonomic nervous system. I think it's enjoyable. I think it's compared to the spinal tract. But I think it's a little bit more enjoyable because you'll definitely be using this stuff. Just again, be aware that a lot of students find that this is seems to be easier material, more, not that it's easier, but that it's more conducive. It's more making sense. So they don't spend that much time on studying this when they take the exams, like, oh, I didn't know it after all. Just make sure you do the review questions on this. Okay? Any questions? No? Okay.